24 million people off the insurance rolls. It will impose an additional age tax on millions of seniors. It will, in fact, increase from 24 to 29% the premiums of those who have insurance either through their employer or on the private market. The majority of members of the House of Representatives knew this was a bad bill today. America should lament the fact that all of them didn't vote that way, and America will hold them accountable. I now yield to my friend, the Assistant Leader from South Carolina, my friend Jim Clyburn.
Thank you very much, Mr. Whip. Madam Leader, fellow members, I have often referred to the Affordable Care Act as the Civil Rights Act of the 21st century. And I've referred to it that way because at the core of what we were doing when we passed this law was outlawing discrimination against sick people, especially those with pre-existing conditions. And I've quoted Martin Luther King Jr. on several occasions when he spoke back in 1966, saying that of all the forms of inequality, injustice in healthcare is the most egregious and inhumane. What we did today in passing this legislation was absolutely inhumane because it will allow the reinstitution of egregious forms of discrimination against some of the most vulnerable people in our society. Now, the thing that bothers me most about this legislation comes from my own experiences, not just in my family, where my mother was diagnosed with multiple myeloma and told at the time she had only 8 months to live. She had insurance. But 2 months later, we read the fine print when we were notified that all of her insurance had run out. So we spent the next 6 months of her life spending all of her life savings trying to keep her comfortable. Wow. This is repeated too often in our society. And what we did with the Affordable Care Act was step away from those kinds of experiences of the American families in America. And what we will see in the very near future, if this were to become law, is a return to those kinds of junk policies. In fact, what my mother had was just a cut above a junk policy. When people find out as soon as they get sick, go for their second treatment, that they have used up their benefits, sometimes annual, sometimes for a lifetime. To return to that kind of situation for the American people is egregious and inhumane, and I think King got it right 50 years ago. We got it wrong today. And with that, I'd like to yield to our Vice Chair of the caucus, Vice Chair Sanchez.
So today is a dark day for the American people and for my colleagues that stand up here that put up a good fight. And I just want to remind people what is at stake and what we've lost today. I received a letter, an email letter from a constituent that I think perfectly highlights the serious challenges that Americans would face under Trump care. I have a constituent named Brandy from Lakewood, California. She's a 36-year-old pediatric nurse practitioner who works with children in Los Angeles and Orange County. She works with children who are in hospice. And I'm going to quote from her letter, quote, "I was also diagnosed with type 1 diabetes at the age of 11 months old, asthma at age 2, skin cancer at age 13, rheumatoid arthritis at age 19. What may surprise most people is that I'm also fit, a triathlete, and a 6-time marathoner. I speak to children about accomplishing their dreams and surpassing expectations. That being said, if the current draft of healthcare reform is passed, I will become just a number. I will be a number who will be discriminated against by the pharmaceutical and insurance industry. I will become a number who will have to sacrifice food and mortgage in order to pay medical bills. I will most likely become too ill to continue my hospice career, and very few people have my training. This would lead to kids dying of diseases, not getting the care that they need and that they deserve. It's heartbreaking to read her letter because she personally understands what's at stake. And now that House Republicans have voted to pass Trump Care, it's going to be clear to every American who broke the healthcare system. Whether they voted for it or not, Republicans own Trump Care now. The millions of Americans who will see their premiums increase will know who to blame. Americans can direct their calls to Republicans when they lose their health care coverage. The American people can thank Donald Trump and the Republicans when they hit their lifetime cap, when they suffer a serious illness or an injury. Democrats will not allow Republicans to run and hide from this vote. We will make sure they know it is Republicans who are responsible for their higher costs and their shoddy insurance coverage. And my Democratic colleagues and I will continue to fight to save as many Americans as we can from the effects of this terrible bill. And with that, I'd like to turn the microphone over to Ben Ray Lujan from New Mexico.
Thank you, Linda. Well, you just saw Republicans do something that the American people thought would never happen. Where we had worked together to make sure that we were taking this fight to our brothers and sisters, friends and neighbors across the country. To reject the notion that we would see the repeal of the Affordable Care Act. But what Republicans did today was increase your premiums, increase your deductibles, increase your out-of-pocket costs. If you're 50 to 64 years of age, they thought you should get hit with something called an age tax. And if that's not bad enough, 24 million people could lose their coverage. And then Republicans had the audacity, as our vice chair reminded us, that in this notion of this game with high-risk pools, annual and lifetime caps were just brought back by Republicans with their vote today. And the protections that the American people could count on, where pre-existing conditions were a thing of the past, if you had cancer or diabetes or you got hurt on the work site, Republicans brought back pre-existing conditions today. So we have to make sure that we take this fight to the American people. We have to work hand in hand, day after day, to make sure that the country knows what Republicans did to them today. Trust me, Republicans will bear the burden of this vote today. With that, I yield back to our distinguished ranking member of the Energy and Commerce Committee, Mr. Frank Pallone.
Thank you, Ben Ray. I just want to debunk this myth that the Republicans keep preaching on the floor, that somehow this is repeal and replace. This is not replace. There is no replacement. Whatever the issue is, I mean, we made it possible, or we make it possible under the ACA, because I still believe it will, the Senate is not going to actually act on this or do anything that ultimately would repeal the ACA. But the bottom line is we made it possible for people who were at a certain income to get Medicaid through the expansion of Medicaid, and we made it possible for people on the individual market to get a major subsidy depending upon their income. And that's how we expanded the number of people who have health insurance. And what this Republican bill does is it takes away the pay-fors, if you will, the way that we paid for these subsidies, the way we paid for the Medicaid expansion. So the notion that somehow this is a real replacement that's going to guarantee people health insurance is totally false, because the money isn't there anymore. There's not money for the subsidies. There's not money for the Medicaid expansion. The Medicaid expansion essentially will not exist. And the same thing, look, if in the old days, you might have been able to get some kind of junk insurance policy because you didn't have a guaranteed benefit package. They were selling a $50 policy per month in North Carolina that didn't have hospitalization, for example. And we wanted to make sure that people got good health insurance, that they had hospitalization, they had behavioral health care, they had maternity care, the essential benefit package. And we did that, and that's what the Affordable Care Act does. But they're saying, oh, we're going to get rid of the essential benefit packages, or where states are going to be able to raise premiums because there'll be no more community rating. They can, charge you whatever you want. Bottom line is, this takes us back to the days when people could not afford health insurance and they had a lousy benefit package. And that's where the Republicans are taking you with this repeal. And we're not going to stand for it. And we're going to explain to the public that that's what this is all about. The good old days before the ACA were not the good old days. Things improved because of the ACA. And we're not going to let them go back to those days when people suffered and didn't have health insurance and didn't have good benefits. And we're going to work to make sure that the Senate doesn't pass this bill and that ultimately the Affordable Care Act remains in place. Thank you. Thanks to all my colleagues, Nancy and Stan.
Sheila Bobbitt.
Thank you, Frank.
Thank you. This is a sad day for those who need health care, and I think it's important to remind people what progress has been made since the passage of the Affordable Care Act. Costs have gone up at the slowest rate in 50 years. Those with pre-existing conditions can get insurance at the standard rate. Instead of millions of people losing their insurance every year, 20 million more people have insurance. We have consumer protections like no caps on benefits, prevention and cancer screenings, no copays and deductibles. Young people up to 26 can stay on their parents' policies. We're closing the donut hole. We've invested in community health centers. We're investing in education for doctors and other professionals. And we have essential benefits, including mental health and prescriptive drugs. That's progress, but all we hear from the other side are complaints, promises, and press releases. Unfortunately for them, the Congressional Budget Office reviewed the last version and found that notwithstanding all of their promises and complaints, their bill would result in 24 million fewer people having insurance. Those that get insurance will pay more, and the policies would cover less. They didn't make that mistake again by having the Congressional Budget Office review this version, but there's nothing in it that makes anything better. It just makes many of the things worse. One of the kind of confusing issues in the debate surrounded pre-existing conditions. We have said that people lose their protection. They said they're protected. Let me tell you, what's in the bill says you cannot technically deny people coverage notwithstanding a pre-existing condition, but you can charge them virtually whatever you want. The estimates are your premiums will go up $10,000, $20,000, and maybe $30,000 a year. They can price it so that you can't get it. Under the present law, you get insurance notwithstanding a pre-existing condition at the standard rate, and you lose that benefit under their law. And with that, yield back to the distinguished leader.
Thank you very much, Mr. Scott. I thank our ranking members. I think what you have seen here, listening to our leadership and two of our ranking members, Mr. Scott and Mr. Pallone, and I would compliment also Richie Neal, our ranking on Energy, Ways and Means, and Mr. Yarmouth from Budget for their superior knowledge on this subject as well. When you know the facts and you care about people, you can't possibly vote for the bill that they voted for today. So what do? Either they don't know, or they don't care, or both. Some of our members think they really don't care, so that's why they don't want to know the facts. But this is very central debate for us, for our country, because it's about the health and well-being of our country, a measure of the strength of America, not just our military might, which is important, but the healthy education, the well-being of the American people. This is about our strength. It's also about an allocation of our resources. So right now, the Republicans are in the Rose Garden having a beer party to celebrate one of the biggest transfers of wealth from working families to the richest people in our country, and that is what they have been about. The trickle-down crowd is now having a beer party in the Rose Garden. But we will continue to take the case to the American people. And by the way, they're taking the case to us. They know how this affects them. So this is, again, everything is an opportunity. Two people there, and it could be any two of their 216, whatever it was, the two people there have made a difference in the lives of the American people, and we will hold them accountable. Any questions? Yes, sir.
This bill now goes to the Senate, and based on, you said this morning that this bill can't pass.
I quoted the senators as saying that it wasn't going to.
Based on what you've heard in the math over there, what changes are you anticipating, and if they're made, can they pass when they return to the House?
Well, I really can't speak to what, in other words, they just passed it here, and so we'll see what the Senate does. But again, this thing is intrinsically, so it's about who decides what that is, and that had been eliminated under the Affordable Care Act. Being a woman was no longer a pre-existing condition. And then the question of, sure, you can have coverage for pre-existing condition. You could never afford it. You could never afford it because it would be endless, especially as time went by and your condition worsened. As you heard Congresswoman Sanchez say about that person, she had a pre-existing condition and another one and another one. May I say thank you for that. And Joe Crowley, who was with us, had to get a train, so he could not be with us to respond to that. Stenny, did you want to speak to that?
I just wanted to make a comment. I don't think the Senate's going to pass this bill in its present form. They may add amendments. I don't know. We'll see. But I wanted to add something to what we've said. Whether it passes the Senate or not, since January, they have been undermining the confidence in the marketplace. They've undermining the confidence of insurers, undermining the confidence of patients, undermining the confidence of providers. When you have confidence undermined, it drives prices up. I talked to an insurer in Maryland, I won't mention the insurer, who assessed that when Mulvaney said we may or may not pay, the White House had said they were going to pay. Talked both to the leader and myself and said we're going to pay for the cost subsidy on deductibles. And the marketplace was threatened, and it had an impact. When they continued to offer this bill, every time they offered this bill, in whatever form it was, it undermined the confidence of the market. And when you undermine the confidence of the market, you decrease availability and increase cost. And very frankly, one of the things I fear is you're going to see in the next few days some very negative announcements by companies who have no confidence in the market because of the actions the Republicans have taken over the last 4 months.
I just want to add that nobody is with them. If you look in the record and some of what we talked about this morning, every organization, every delivery of service, delivery of insurance, faith-based group, nobody is with them. American Cancer Society, you name the diagnosis, they're not with them. The AMA, they're not with them. The March of Dimes, they're not with them. So they have no one with them. So you would think they might say, what judgment did I make that nobody has a respect for what I am doing? I just want to say how pleased I am to be that we're here with Congressman Green of Texas, Congresswoman Barbara Lee just walked out, a member of our leadership of California, then Don McEachin of Virginia, and a freshman member, Brenda Lawrence from Michigan, and some other members had been with us. I want to recognize them as being here. But what would be a wonderful thing to see is if the Senate said, okay, let's take the Affordable Care Act and let us see what we can do working together. Because as Stenny said, since January, they've been undermining it. But for a long time in the majority, they refused to implement some of the provisions of the Affordable Care Act with funding for that would head off some of the concerns that have arisen. So they, and just by contrast, when they did Medicare Part D, which we all opposed, but it passed, they had the majority, it passed, we immediately enabled it to be implemented. Our offices were resources to the community, to seniors who would be taking advantage of it, even though we thought it was not a good bill because it gave away the store to the pharmaceutical industry and increased the deficit by so much. But nonetheless, it was the law we implemented. They come in and they're saying we don't want to fund navigators to do outreach so that people can take advantage of this, undermining the good health of the American people. But you know what? They've been whining for 7 years about the Affordable Care Act. Now let them defend what they did today. We welcome that discussion. Any other comments, my colleagues? No? Okay. Thank you. Oh, yeah. Oh, yes, sir.
Just a quick question. You touched on it briefly, but would you mind responding to the members going to the White House now and the president tweeted about, victorious.
Yeah. Remember I said about the Republican members either not knowing or not caring about it. Whatever they don't know is only matched by the President of the United States. Some of his statements about the Affordable Care Act, you're like, what are you talking about? Do you have a staff that can at least have you make a informed statement? Even if it's negative, you don't like it, but know what you're talking about. As recently as today, or yesterday, but reported today about the pre-existing medical condition. Oh, the $8 billion, that's more money than we need. No, it's a pittance, according to the conservative think tank. It's a pittance, and over 5 years, it's a fifth of a pittance. According to the Kaiser Family Foundation, it will cover 1% of those in the individual market, and somebody else said, well, it could maybe be 5%, 100,000 people. So the president, it's really sad because suppose we grant people their position, but at least know what you're talking about so that we can respect the debate back and forth. But when you think about decisions that are made by people who do not know what they're talking about, or perhaps know and don't care about the American people, that's a problem for us. But we are, we're steamed. We're ready to go to bring on that debate and listen to the American people, because all along they have spoken out on this since the election. So,
just, if I can add, they're going down to celebrate something that comes way, way, way short of what the president looked the American public in the eye and said he was going to deliver. Insurance for everybody at less cost and higher quality. This bill comes nowhere close to that promise. So they are celebrating a broken promise.
And a tax break for the rich.
Leader, if I could just add something there, too. So think of the signal that Republicans are sending to the American people. They just voted to increase your premiums, increase your deductibles, bring back pre-existing conditions, arguably bring back annual and lifetime caps, and they're out in the sun, in the Rose Garden, toasting champagne and cracking cold ones. That's what they just told the American people. The American people will reject that entirely. And so I'm glad you asked that question. It's an important one to capture.
Well, and I think you have to identify who is celebrating, who benefits from the bill. As Sidney just mentioned, higher costs, fewer people insured, policies cover less, children in neonatal intensive care units that run up almost their lifetime benefit before their first birthday, they don't benefit. People 50 to 64 under Medicare will see their rates go up significantly. Those with pre-existing conditions will see their rates skyrocket. Who benefits? The tax cuts. The tax cuts. I must say that one of the members, or more than one, but this thought came from some of the moderate members. Well, it doesn't really matter because the Senate is not going to let this pass. But they have put their name next to some of the worst provisions in this bill. So, again, if we look, we should be sadder because this passed. We are, for the uncertainty it injects into people's lives. But maybe we had to hit rock bottom, and that's what's happening in the Rose Garden right now, rock bottom. One last question?
Yes, we're reporting over at the Washington Examiner that the Senate won't take up this version of the bill. This is breaking, and they're going to write their own. Any comments based on that?
But I have heard that, but...
Just a real quick question. Whose idea was the singing on the floor from your side?
Oh, I think that was spontaneous. I had no idea.
Yeah, it was spontaneous.
I had no idea. Oh, no, they all seemed to just burst into song.
Thank you, guys.
Thank you.